Hi everyone. So welcome back to Thursday Reading Live. My name is Vandana PS, one of the reading trainers from Nidus Academy. Okay, so as usual, I'll give you a sample question from part B. Okay, so please do the question, because if you guys are doing the question, then you will get to know how to do part B. Okay, then after the question, I'll give you a lot of details regarding how to do part B. Okay, so I'll give you 2 minutes to do the question, so then we will discuss the answer. So here comes the question. Okay, so welcome back to the live session. So did you all do the question? Okay, so I'll read the question, then we will discuss. Okay, so any idea in which category the question falls under? Okay, so when you do part B, it's very important you should know about. We have 3 categories in part B. Okay, so in those categories we should know in which category this particular question falls under. Okay, so I'll read the question, then the options and the paragraph, then let's discuss the answer. Okay, yeah, so the question, the purpose of the memo regarding the safety update is to. Okay, so that is the first step. Read the question. So what is the question? The purpose of the memo regarding the safety update is to. Then the second step, underline the keywords from the question. Yeah, the strategy, I mean the method is the same, so you can underline the keywords from the question. So my keywords which are purpose, then regarding, then update. Okay, so these are my keywords from the question. Okay, so yes, Reba, Shiny, Libby, Shiny. Okay, good afternoon. Yes. Okay, so these are the keywords from the question. So read the question, underline the keywords. The third step is understand the question, and that is the most important one. Okay, so we have to understand the question. So again, I'm coming back to the first question. So in which category the question falls under? Okay, the category, any idea? Yes, Shiny, it's from the third category, memo. Okay, already it is mentioned in the question, it's from the third category, memo. That's from third category, memo. So my next question is that if it is in the third category, then what are you reading for in that category? Okay, so what are you reading for? Any idea? Any idea? If it is a memo, then what are you reading for in the third category? Okay, Brancy, it is third category, memo. Then if it is a memo, then what are you reading for? Very good, Reba. Then we are reading for the purpose. Okay, so what do you mean by purpose? Okay, so the purpose, which means the overall idea. Okay, so third category, which means maybe an email, then memo or notice. Okay, if the question is asking you from the third category, then we are reading for the purpose, to understand the purpose. Okay, an overall idea. So we are reading for the purpose, right? Okay, then what about the option? So the third one is understand the question. Okay, then what is the fourth step? So either you can read the options or you can read the paragraph. So I'm going to read the options first, but before that, let me tell you regarding something about memo. Okay, and in memo we have actually 4 different types of memo. Okay, so what are they? Any idea? What are the different types of memo? Okay, let me know in the comment box. What are the different types of memo? Any idea? Okay, Shiny, we are reading for the purpose. Okay, dear. Yes. So what are the different types of memo that you guys know? Any different types? Any different types of memo? Okay, warning. Yes, warning memo. Then, any idea? Anything else? Okay, so we have 4 different types. The first one is, okay, advice memo. Okay, advice memos will be there. Second one, warning or reminder memo. Okay, warning or reminder memo, and this is one of the examples for the second one, warning or reminder memo. And the third one, request memo. Okay, and the fourth one, confirmation memo. So these are the 4 different kinds of memo. Okay, advice memo, then warning or reminder memo, then request memo and confirmation memo. Okay, so this is one of the examples for the second type, that is warning or reminder memo. Clear? Okay, then coming to those options. Okay, first one, inform the doctors to avoid using clozapine medication. Okay, so what are the keywords from the first option? So my keywords, doctors, avoid, then clozapine. Okay, and from the second option, inform the conditions that can be caused due to clozapine. So my keywords, conditions, then caused, then clozapine. And from the third option, inform the contents emphasized in the warning box. So my keywords, contents, emphasized, warning box. Okay, so these are my keywords from these 3 options. Okay, yeah, so that is the next step. Then the last one. Okay, so before moving to the last step, you should read the paragraph. Okay, so I'll read the paragraph, then we will discuss what is the answer. Okay. Okay, Riba, already you got that answer, right? Okay, so clozapine safety update. Okay, the potentially fatal risk of gastrointestinal hypomotility in patients taking clozapine has been highlighted with a new boxed warning in the product information in this medicine. What medicine? Clozapine medicine. Then health professionals should assess for constipation before and during treatment with clozapine and manage suspected constipation promptly to prevent severe complications. Okay, so to prevent this condition, we should follow whatever it is mentioned inside this new boxed warning. Clear? Then the severe gastrointestinal effects of intestinal obstruction, severe constipation and gastrointestinal hypomotility are among the most serious adverse reactions experienced with this medicine, I mean clozapine. In post-marketing experience, severe complications of gastrointestinal hypomotility such as intestinal obstruction, fecal impaction, megacolon, then paralytic ileus and intestinal ischemia or infarction have resulted in hospitalization, surgery and death. Okay, then the new boxed warning or the new boxed text, okay, and other changes to the PI expand on existing warnings about severe gastrointestinal adverse reactions associated with clozapine, which are primarily due to its potent anticholinergic effects. Okay, so that's all about the paragraph. Okay, so any idea what will be the correct answer? Okay, any idea? Let me know in the comment box what is your answer for this particular question. Okay, so what method we are using here, I mean what strategy we are using here? We are using the strategy that's called elimination method or elimination strategy. Okay, so how can we eliminate these options? Okay, and we have chances, right? So one of the option will be contradictory option or opposite option, and not mentioned option will be there, as well as one correct answer will be there. So we are moving to elimination method. Okay, so I'm starting with option A. Inform the doctors to avoid using clozapine medication. I'm going to eliminate option A. Why? It's not mentioned anywhere in the paragraph. Is it mentioned anywhere? This is like an information to the doctors who can avoid clozapine medication. Okay, it's not about avoiding the medication, so it's not mentioned anywhere in the para. And what about, yes, very good Reba, option A is not about avoiding the medicine, right? Yes. And what about option B? Inform the conditions that can be caused due to clozapine. Okay, so is it all about what are the conditions or what are the disease conditions that can cause with this particular medicine? Okay, the conditions mentioned I agree, but it's not about the overall idea, because question is clearly asking you regarding the purpose of this memo. So the purpose is not about what are the disease conditions, right? Okay, so you can eliminate option B. Again, it's contradictory, or I can say opposite option. Okay, it's not about the conditions. Okay, and what about option C here? Through elimination we reached option C. Yeah, and that's the correct answer. Okay, so whether you like it or not, my answer is option C. Inform the contents emphasized in the warning box. And I will give you another clue. Okay, see this question. Okay, so what about the question? Safety update. So what do you mean by updation? If you guys are updating some, apps or something, definitely it's for the new or latest changes that's gonna happen, right? Okay, so safety update, which means new changes that's gonna happen. Okay, so updation. Okay, safety update. So where is it mentioned? See the last para, the new boxed text. Okay, or the new boxed warning, as well as in this second line, first and second line also, clozapine has been highlighted in the new boxed warning. Okay, so that means the updations, right? Okay, so answer is option C. Inform the contents emphasized in the warning box. Warning box, which means a new one. Okay, so answer is option C. Clear? Any doubts? Any doubts in this? Okay, yes, Reba. A lot of correct answers here. Yes, Reba got option C. Aku, Libby, then Shiny, Claudin, okay, Brincy, excellent, very good. Okay, so that answer is option C. Okay, so now we are just jumping to the next important part from this module, which is part A. Okay, so how was the material? Was it really easy? Easy or no? Okay, so what about the material? I think this particular material is very easy. Okay, yeah, so new topic here, that is 𝐸𝐴. Okay, so that's the new material. Okay, so what about part A? So before moving to the material, I'll read part A in detail today. Then we will mark all the important keywords from the text, and then we will answer to the questions. Okay. Yes. Okay, Reba, it was easy. So happy? Okay. So tomorrow I'll give you a very tough material. Is it okay? Yes. Okay. So coming to this material, so let's do one thing. Okay. So first of all, let's skim and scan. Okay, I'm going to apply the technique first. Which means I'm going to apply skimming and scanning. So what is skimming and scanning? Just a random question. Okay, what is skimming and scanning? Yes, Reba, what is skimming and scanning? And by the way, what happened to you yesterday? Okay. Yes. Yeah, so what is skimming and scanning? Any idea? What is the meaning of the word skimming? And what about scanning? So what is in combination or together? It's called, what is it called? Okay, Reba, 20 questions, 15 minutes, skimming and scanning method, 1 to 7, match the following. And what about the rest here? Okay. Yes, quick reading and searching important words. Very good, excellent. Okay. Very good, Shiny. Yes, fast reading. Okay, so skimming, which means fast reading, and scanning, which means searching. So searching, which means not just randomly searching, we are searching for important words. Okay. Yeah. Okay, so let's do skimming and scanning now. Okay, so please read the text and tell me what are your keywords. Okay, if possible, please let me know in the comment box what are your keywords from text A, B, C and D. Okay, so intertrigger is a common inflammatory skin condition that is caused by skin to skin friction or rubbing that is intensified by heat and moisture. Okay, it usually looks like a reddish rash. Trapped moisture, which is usually due to sweating, causes the surfaces of your skin to stick together in your skin folds. The moisture increases the friction, which leads to skin damage and inflammation. Okay, so my keywords from the first para. Okay, yeah, first of all, the name of the disease condition, then inflammatory, common, then friction, rubbing. Okay, reddish, moisture, usually sweating. Okay, yeah, so these are my keywords from the first paragraph. Then the second, intertrigger often leads to a fungal or bacterial infection. This is known as secondary infection. Candida or Candida, a type of yeast or fungus, is most common cause of secondary infection related to intertrigger. There are a few names for intertrigger, also known as intertriginous dermatitis, depending on certain factors such as it appears if it is caused an infection or not, acute intertrigger, recurrent intertrigger, chronic intertrigger, uncomplicated intertrigger and interdigital intertrigger. So these are my keywords from this particular first text. Okay, and before moving on to the next one, I am just marking acute, recurrent or relapsing, then again complicated or chronic, and also fingers, toes, parts of the body. Okay, so that is my keyword from text A. So likewise, let me know. Okay, yes, shiny, inflammation, reddish, very good here, friction, rubbing. Okay, Riba, 1 to 7 match the following, 8 to 14 short answers, 15 to 20 fill in the blanks. Important keywords, heading, subheading, numbers, signs and symbols, names, brackets, abbreviations, italicized letters and bold words, words indicate time, research. Very good dear. Okay, so likewise I'm marking all the keywords here. Okay, shiny, fungal, bacteria, secondary. Okay, fine, yes. Then moving to the second text. Okay, it's all about diagnosis. If the heading or subheading is mentioned, you have to underline the heading or the subheading. Okay, so diagnosis here. Then, so what about the diagnosis? What methods we are applying to find out this disease conditions? We can go for a Woods lamp examination. Okay, then a Woods lamp is a small tool that uses black light to illuminate areas of your skin. Your healthcare provider will hold a tool over your affected skin in a darkened room. If a certain kind of bacteria or fungi is causing your infection, the light will cause the affected area of your skin change color. Then skin scraping. Okay, your healthcare provider will use a tool to scrape and remove some of your affected skin. They will look at the skin sample under a microscope, so name of a device, to see what kind of fungus or bacteria is causing your infection. Then skin biopsy will be there. So what is skin biopsy? Your healthcare provider will use local anesthesia and biopsy tool to remove a small piece of your skin. A laboratory technician or a pathologist will then examine it under a microscope to ensure an accurate diagnosis. Okay, so these are another keywords. Okay, so text to see is all about a pictorial is mentioned here, and that's all about treatment, which means maybe a lot of medicines mentioned here. Okay, and let's check. So type of intertrigo, then recommended therapies. So simple intertrigo infected by bacteria, yeast. Okay, then dermatophytes, then erythema. Okay, so complicated by, yes. So these are my keywords, and on the other side we have a lot of medicines mentioned. Okay, drying agents such as talc or cornstarch, then topical, mild steroid lotion, predominant inflammation, then topical oral antibiotics, then antifungals, and then a lot of medicines inside this bracket. Okay, yeah, same medicines repetition is there. Okay, again antifungals, okay, topical or oral erythromycin. Okay, so these are the keywords from text to see. Okay, okay, shiny Wood's lamp examination, scrape, microscope, biopsy, anesthesia. Okay, that's from text to B, and text to see is all about a lot of medicines, okay, and therapies. And finally, text to D, risk factors for getting intertrigo include. So what are the risk factors? Complications, okay, convolutions or ramifications of the condition. A lot of risk factors. Obesity is the first one. Okay, incontinence, then excessive sweating, excess skin forms significant weight loss, as well as your age is also a risk factor. Okay, so that's all about that. And intertrigo is strongly associated with having obesity. People who have obesity usually have more pronounced skin folds and increasing sweating. It can also be more difficult for people with obesity to properly clean and care for their skin folds. Okay, then people who have urinary incontinence not being controlled, okay, not being able to control their bladder, and or fecal incontinence not being able to regulate, okay, their bowel movements, then are at higher risk for intertrigo because pee and or poop in an absorbent undergarment creates a warm and moist environment. If you already have intertrigo, contact with sweat, pee or poo can make your intertrigo worse. Okay, then excessive sweating known as hyperhidrosis can put you at high risk of intertrigo. So yeah, risk factors mentioned. Then people who have excess skin from significant weight loss are more likely to get intertrigo due to skin folds rubbing together, okay, because the friction. Okay, then intertrigo is more common in babies as well as in older people, okay, geriatric population. Babies are at high risk of intertrigo because their skin is sensitive and they often have moist skin from drooling or from wearing diapers. It can be more difficult for older people to bath and care for their skin routinely, so they are at higher risk of intertrigo. Okay, so that's all about text D. So likewise, okay, you can read and underline what are the keywords from each of the text. So this is the first method we have to do. Okay, so when you get a text, please do skim and scan. Okay. Then we are moving to the question and answers. Okay, so now let me condense something regarding part A. Okay, so what is part A? So part A, which means we have 4 different texts. Okay, text A, text B, text C and text D. Okay, clear? And each of the texts will be different from one another. Okay, and what about the timing? You will get, okay, so 4 different texts, and you will get 15 minutes to complete 20 questions. And this 20 questions can be categorized into 3 different sections. Okay, so the first one is that 1 to 7 set of questions that can be called match the following questions. Then 8 to 14 set of questions, short answer questions, and the rest of it, which means 15 to 20, it's fill in the blanks. Clear? So that's all about this categories of questions. Okay, then so what about the first one? Okay, already I have told you regarding what method you can apply. So that's skimming and scanning. Okay, so now you know what is skimming and scanning. Then important keywords you have to underline. So what are the important keywords? And Reba already commented about this important keywords. Okay, so something is missing, I'll add something. Okay, so the first one here, all the heading, then all the subheading, all the numbers, then names, okay, signs and symbols, abbreviations, all the brackets, then italicized or bold words, then the times indicator, the words that indicate time, the words indicate experiment related words, then the words that can be connected with research, then the first and last line of each and every paragraph, as well as all the bullet points. Okay, so this is all we have to underline. Okay, so when you skim and scan. Okay, Brincy, risk factors mentioned in text D. Yes dear, very good, yes. It's all about the complications, risk factors. Okay, then coming to the first set of questions. Okay, number 1, systems exerted to detect the presence of intertrigo. So which means what are the ways used or employed to identify the presence of intertrigo. So what are the conditions, or not conditions I can say, what are the methods, what are the ways? Okay, identification methods. Very simple. So any idea? What is the correct answer? Let me know in the comment box. What is the correct answer for question number 1? Okay, yes. Okay, so my answer is, so before that I'll underline keywords from the question also, because it's very important. So systems exerted to detect the presence of intertrigo. So my keyword, systems exerted detect. Okay, and from these 3 keywords I understood it's all about the diagnosis. Okay, so where they've mentioned about the methods of identification, that's from here. Okay, so that's from text B. So my answer is B. Okay, yes, Reba, Shiny, Libby and Brincy, very good, your answer is correct. Okay, then second one, the link between body weight and intertrigo. So my keywords, link, then body weight. Okay, so where they've mentioned about body weight as well as the disease condition. Okay, let me know in the comment box. Second question, link between body weight and this disease condition. Okay, so that's from here, text D. See the first one, okay, obesity, which means the body weight. Okay, so there is a connection with body weight because it is one of the risk factors. Okay, and that's from D. Yes, okay, Riba, Libby, Shiny, Aku, excellent, it's from text D. Okay, Brincy, yes, Jinsey, Joes, it's from text D, very good. Then jumping to the third one. Okay, how do we contrive intertrigo that augmented from bacterial infection? So my keywords, contrive, then augmented bacterial infection. Any idea where they've mentioned about the bacterial infection as well as increase in bacterial infection or development of the bacteria? Okay, third one. Okay, so the bacterial infection I've seen which is in text C. Okay, see, bacteria, intertrigo infected by bacteria. Yes, so that's C. Okay, so okay, Suji, hi Suji. Okay, dear. Okay, Suji. Yeah, third one is from text C. Okay, Jinsey. Yes, it's from text C. Yes, Brincy, text C. Okay, fourth one. What about the fourth one? The different types of intertrigo. So different types. So what about fourth question where they've mentioned about different types of the condition? Okay, Renu, it's third question from text C. Very good, dear. So what about fourth one, Renu? Any idea? Okay, Suji. Yes, Shiny, Reba, answer is A. Okay, I am just moving to text A because you guys told me that it's from text A. So yes, it's here. So what are the different types? Acute, recurrent, chronic, uncomplicated, interdigital. Okay, so these are the types. Okay, so which is from text A. Then fifth one. What about fifth one? Any idea? Fifth question. The susceptible group for intertrigo. So susceptible group. Susceptible, which means I can say very weak. Okay, so which means these group of people, they are very easily affected by this disease condition. Okay, so any idea who are the susceptible group contingents out there? Okay, yes, a lot of correct answers for the fourth question. Okay, Reba, Shiny, Libby, Aisha, Brincy, excellent, it's fourth. Okay, it's from text A. Fifth one, any idea? Fifth one, susceptible group. Okay, so susceptible group I have seen here in text D. Okay, see, according to your age is one of the complications for or risk factors of this condition. So intertrigger is more common in babies and all people. So babies are at a higher risk for intertrigger. See, they are susceptible. So answer is, okay, so what is the correct answer, which is D. Okay, then sixth one, how does intertrigger onset in an individual? How it will start in an individual, a person. Okay, so how does it start? Onset, individual. Yes, these are my keywords. Yes, Shiny, it's from text D. Very good, dear. So what about others? Okay, Reba, sixth one. Okay, so I'm just moving to text A because you guys told me it's from text A. Okay, so yes, it's all about how it is starting. Okay, the disease condition is mentioned in text A. Intertrigger is a common inflammatory skin condition that is caused by skin to skin friction. So answer is A. Okay, and I'm jumping to the final seventh one. Cite some examples for oral antifungals. So examples, oral antifungals. Okay, again I've seen this word oral antifungals in text C. Okay, one of the see here. So oral antifungals is here, then oral antifungals here. See. Okay, so definitely answer is C. Okay, so any doubts regarding 1 to 7? Okay, yes, Reba, sixth one is from text A. Okay, Libby, fifth one text D, seventh one C. Okay, Shiny, sixth one A. Excellent. Okay, so that's all about that. So now it's time for doing 8 to 14 set of questions, which are short answer questions. Yeah. Okay, so what is important instruction? We have an important instruction here, that is you can write it in a word or a short phrase. So maximum 3 words. Okay, so question number 8. The causative organisms behind intertrigger that are treated by antifungals. So what are the causative organisms behind this condition? Any idea? What are the causative organisms? So my keywords, causative organisms and antifungal. So the word is only mentioned in text C. Okay, antifungals. And I'm searching for the other keywords. Okay, so antifungals, then what else? Okay, so what is mentioned here other than that? Any idea? What about 8th question? What is the answer? Organisms, causative organisms. Yeah, first one is yeast. Okay, then another one, because we need organisms, which means plural, right? So one more will be there. Yeast and or yeast comma anything else? Okay, so the first one is yeast because topical antifungals, and the second one is dermatophytes. That is the second one, again it is connected with antifungals. So we have 2 answers there. First one is yeast and second one is dermatophytes. Okay, so yeast comma dermatophytes should be the answer. Clear? Okay, yes, Shiny, Libby, yeast plus something, that is dermatophytes. Okay, then 9th one, and that's from text C. Okay, yeah, 9th question. What name can be used alternately for immoderate sweating? Immoderate, which means very severe. Okay, what name can be used alternatively? Immoderate sweating. So sweating, and that is one of the complication, I guess. So that's from text D. Okay, see, excessive sweating or immoderate sweating. Excessive sweating known as hyperhidrosis. So, very simple question, answer is hyperhidrosis from text D. Okay, Reba, yes. 8th one is yeast and dermatophytes. Very good here. Okay, one suggestion I have, it's not yeast and dermatophytes, it's yeast, dermatophytes. Okay, it's not and, it's comma. Yeah, so what about next one? 9th one is hyperhidrosis. Okay, and 10th question, any idea? Let me know in the comment box. What is your answer for question number 10? Which drug can be used to treat intertrigo intricated by erythema? So, erythema, intricated drug. What drug? Okay, okay. So, which drug? Any idea? What drug we are using for that? What is the name of the drug? Okay, so drugs mentioned in text C, no doubt. Okay, and from text C, identify your answer. Which drug is mentioned? Any idea? For erythema, yes. Okay, so that answer is from the last. Okay, very good. So, answer is from the last point, which is from here. So, yeah, erythema is here. So, what medicine we are using? It's topical or oral erythromycin. Okay, so we have two answers again there. It's either topical or oral erythromycin. So, you can write both because yeah, maximum 3 words, it's only 3 words, topical, oral erythromycin. Okay, then the next question, 11th one, which are the high risk groups for intertrigo? So, which are the high risk groups? Which high risk groups? Okay, any idea? Yeah, already we have dealt with this question. I mean, susceptible group, yeah. Okay, so that's from, it was from text is D, right? Yes. So, who are at high risk here? So, high risk, it's babies are at high risk for intertrigo. And what about it is, yeah, more common among babies and older people. So, you can write babies and older people. Okay, that's from text D. So, from the last point, which is according to the age. So, babies and older people. So, answer is babies and older people. Yes. Okay, Renu? Yes, very good. Okay, Shiny, babies and older people. Yes, G, babies and older people. Yes, Akku? Correct answer. Okay, then I am just moving to the next one. 12th one, a type of fungus which leads to the inception of secondary infection. Okay, inception which means here starting. Okay, a type of fungus. So, type, what type? Okay, these are my keywords, type, fungus, inception. Okay, any idea what type of, so types mentioned in text A and what type is mentioned here? Intertrigo often leads to fungal or bacterial infection. This is known as a secondary infection. Candida or Candida, a type of yeast or fungus. So, what is the answer? Yes. Okay, okay, Akku, yes, Candida or Candida. Yes, Reba. Okay, Libby, Shiny, it's correct answer. Okay, Jinsi, it's Candida. Okay, and that's from text A. Very good. Then 13th one, the instrument with that causes the affected area of your skin to convert color if light is emitted to it. Okay, so instrument, then affected area. So, these are my keywords. So, what instrument? Okay, one idea, the instrument that causes the affected area of your skin to convert color. Okay, so it's, yeah, it's sure it's from text C because it's a method. Okay, they are asking you regarding a method. So, from text B. Yes, so that instrument is called a small tool, that is a Wood's lamp. Okay, Wood's lamp is the instrument. Okay. Yes, Reba, Akku, Libby, Shiny, Renu, Jinsi. It is Wood's lamp from text B. So, answer is Wood's lamp. Okay. So, you can write there Wood's lamp. Yes. Then 14th one, the methodology or the procedure, okay, in which some of the skin is scraped and detached, removed to ascertain the presence of intertrigo. So, what procedure? Again, procedure, yeah, the method, that's from text B. So, what method is using to remove the skin? Okay, So very direct answer, right? Okay, okay, Suji, it's Wood's lamp. Okay, Renu, Wood's lamp. Okay, okay. So what about the next one? 14th one. Any idea? To remove the skin. So either it is regarding skin biopsy or skin scraping. It's from skin biopsy, right? Okay, or skin scraping. So that's skin scraping. Okay, so your healthcare provider will use a tool to scrape and remove some of your affected skin. So that condition is called, okay, or that particular, sorry, not condition, the procedure is called skin scraping. So answer is skin scraping from text B. Okay, very good, Shiny, it's skin scraping. Okay, dear. Then, yes. So already, yeah, skin is mentioned, but see, that is the name of a procedure, so that you can write since skin scraping there, okay? Yeah, 15th one, fill in the blanks. Okay, same instructions mentioned. First one, an individual might possess dash, whether his intertrigo lasts 6 weeks or more. A person can maybe having, yeah. Okay, so what is the condition called? 15th one. An individual or a person might possess dash if or whether his intertrigo lasts 6 weeks or more. So it's all about here 6 weeks. Okay, and what about the condition called? Very good. Yes, Libby, it is chronic intertrigo. So answer is chronic intertrigo. If your case of intertrigo has lasted 6 weeks or more, that's called chronic intertrigo. Okay, so answer is chronic intertrigo from text A. Then 16th one. Okay, whether an individual has interdigital intertrigo, the areas of his body that are primarily affected by it could be between dash. What about 16th one, guys? Any idea? 16th question. What about the 16th one? Okay, so answer is again from text A. Okay, and the keyword is here interdigital intertrigo. Intertrigo between your fingers or toes. So answer is fingers or toes from text A. Okay, 16th one answer is fingers or toes. Yeah, so that is the correct answer, fingers or toes. 17th one. People who gave obesity usually have more dash and increased sweating. Okay, so yeah, it's overweight is mentioned here in text D, one of the risk factors. Okay, and answer is what? What is the correct answer here? Obesity, intertrigo is strongly associated with having obesity. People who have obesity usually have more pronounced skin falls and increased sweating. So already increased sweating is mentioned there. So answer is very good, Reba, it's pronounced skin falls. Okay. Yes, so those are the missing words. Okay. It is pronounced skin falls from text D. Okay. Then the next one, 18th one. Apart from talc or cornstarch, topical mild steroid lotion can also be used in cases of dash. Okay, so yes, no doubt text C. So what is the correct answer there? 18th one. Any idea? Okay, a lot of medicines mentioned, drying agents such as talc or cornstarch, topical mild steroid lotion in cases of its predominant inflammation. Okay, so answer is yeah. So answer is predominant inflammation from text C. Okay. Okay, Sujay, chronic, yeah, it's from, yeah, 15th one, right? Yes. Okay, Akku, predominant inflammation. Okay, Shiny, yes, predominant inflammation. Okay, okay. And 19th one, I mean second last one, a laboratory technician or a dash will then examine the skin under a microscope to ensure an accurate diagnosis. So, microscope is mentioned here in text B, I guess. Yeah, microscope. Okay, so other than the healthcare provider who will check it, and the word microscope is here also, yes. Okay, so skin biopsy, your healthcare provider will use a local anesthesia and biopsy tool to remove a small piece of your skin. A laboratory technician is there in the question, or a pathologist. So answer is pathologist. Okay, yes, that is pathologist from text B. Clear? And what about the 20? Question number 20. Any idea? 20. Babies are at high risk for intertrigo because their skin is dash and they often have moist skin from drooling or from wearing diapers. So that's from text D, because one of the complications, okay, regarding your age. So yeah, text D. Okay, so what is the correct answer there? It's because their skin is sensitive. Okay, so answer is very simple, because their skin is sensitive, and that is the correct answer for the last one. Clear? So any doubts regarding anything, any of the questions? Okay, yes, sensitive. Okay, Roby, that answer is sensitive. Okay, so that's all about that. So let me know in the comment box, anyone with 20 out of 20. Okay, Denny, Anu Matthew, yes, sensitive. Okay, so anyone with 20 out of 20? Okay, Renu, yes. Okay, Reba, very good. Anyone else? Okay, Siji, yes, sensitive. Okay, 20th one is sensitive. Okay, dear, yes. Okay, so that's all about today. So please stay tuned for tomorrow. So thank you all. Good day.